Welcome to the 38th National Pesticide Forum, Cultivating Healthy Communities. I'm Jay Feldman, Executive Director of Beyond Pesticides. I welcome you on behalf of the staff and board of Beyond Pesticides and the co-convener, the Institute for Exposamic Research at the Icahn School of Medicine at Mount Sinai, and all the co-sponsors of this event. We are so pleased to be able to launch this virtual forum on the 40th anniversary of Beyond Pesticides' founding in 1981. When I first became immersed in the pesticide problem and the solutions in the late 1970s, I met with farm workers in the fields and labor camps of Florida, Texas, and California. The problems were clear as they are today. Pesticide exposure, an inadequate worker protection standard, the absence of personal protective equipment, the lack of a living wage, and the insensitivity to the impact of poisons on human health, children, families, farm communities, and on the ecosystems that support life. We arranged for federal officials, appointees of the President of the United States, and state government officials to hear from farm workers about this human tragedy, and small family farmers told a similar story of illness. The U.S. Environmental Protection Agency funded this work to collect the information directly from farm workers. But as agribusiness and the agrochemical industry and their representatives in Congress got wind of this work, the project was defunded. That was the impetus for launching Beyond Pesticides. We set up in Washington and organized a board of directors of farm worker, consumer, and environmental organizations, farmers, and a physician. We continued pressure. EPA did in 1992 finally adopt a worker protection standard, better, but still with limitations. We began hearing from people in urban, suburban, and rural areas about pesticide exposure from lawn care companies, in schools along rights of way, or from pesticide drift. The accounts flooded in on poisoning and illness, bird and bee deaths, fish kills and contaminated waterways, contaminated homes, and dangerous residues in food. Of course, Rachel Carson had warned society about this in her book, Silent Spring, in 1962, nearly 20 years earlier. We began assembling analyses of the failure of law to protect health, and the data piled up, connecting pesticides to major illnesses. We created databases to ensure that science informs our grassroots advocacy. The solution became clear: advance organic land management and ecological practices for insect management, as well as safe practices for buildings, from homes to schools to hospitals. Many of our values and principles are now embedded in the Organic Foods Production Act. A holistic standard, a precautionary approach, defined practices, allowed and prohibited substances, and a certification system with inspections. Now agribusiness and the agrochemical industry want a piece of the growing organic market, and we must now defend the law's organic principles. Absolutely critical to confronting the climate crisis, biodiversity collapse, and the most serious health threats. These principles are now being applied to local ordinances as local governments embrace efforts to eliminate fossil fuel-based pesticides and fertilizers. A bit about the conference format. We chose this virtual platform because it is interactive and enabling the sharing of information through posters and booths and direct contact with speakers and attendees. We're trying to replicate a real conference, a live conference. If you have not yet set up an informational site at the forum, send us a message at info@beyondpesticides.org and we'll get you the necessary information. With the cross-section of conference speakers and participants from diverse backgrounds, geography, disciplines, from the US and around the world, I'm already feeling the energy of the conference. We believe in the critical importance of coming together annually through the National Forum, sharing essential science, policy issues, and action strategies to advance urgently needed and meaningful change. Thank you for being a part of the forum and sharing your knowledge and experience over the next 4 days. And now the podium goes to Beyond Pesticides Board Chair, Dr. Routt Reigart.
Good afternoon. I'm Routt Reigart. This is the second session of this year's Beyond Pesticides Forum. I am, as I was the last week, if you were here, I am Routt Reigart. I'm chairman of the board of Beyond Pesticides and a professor emeritus of pediatrics at the Medical University of South Carolina. For those of you that weren't in the prior session, welcome. For those of you who were at the last session, welcome back. And I hope all of you continue to attend the subsequent sessions. Today is a very exciting day. One of the major focuses today, I guess I should say foci today, is ecology and the ecology of pesticides as they affect our environment, both in the US and across the world. It's clear to us at Beyond Pesticides that not only do we need to change the use of pesticides in the US to benefit ecologic systems, but that changes that we make affect the rest of the world, and things occurring in the rest of the world affect us. So this is a global issue, and in talking broadly about the ecology, we're able to focus on the global issues. We're very excited today to have Dr. Shanna Swan, who's been one of the pioneers in researching the endocrine disrupting effects of pesticides and other chemicals. She's a wonderful researcher. She's also a mother and has written a book called Raising Elijah, about raising her son in this chemical environment. She's, as I was just mentioning, she's also an outstanding author and a wonderful speaker. And we're very glad to have Shanna here. This is, I think, the second time that she's spoken to the Beyond Pesticides Annual Forum. Today, her talk is about modern life and the threat to the future. I did want to say a bit about how excited we are to have this virtual meeting. We were disheartened last year to have to cancel our live meeting in Boulder, but it gave us the opportunity to develop a virtual meeting, which we find somewhat difficult, but very exciting, as it allows us to reach a lot more people than we were ever able to do in a face-to-face meeting. And we're really happy about the potential success of this. We've already registered many more people than for prior in face-to-face meetings. We're glad to have you all here. We're looking forward to today's session. We are, I hope you're aware, and I'm sure you are if you were here at the last session, very excited about partnering with Mount Sinai at this session. And we will also hear a introduction from Dr. Sarah Evans, who is a faculty member at the Mount Sinai Icahn School of Medicine. Thank you all for being here.
On behalf of the Mount Sinai Institute for Exposomics Research, I want to welcome you all to day 2 of the Cultivating Healthy Communities Forum. We're so happy to be co-convening this truly innovative and comprehensive conference together with Beyond Pesticides for the second time. At Mount Sinai, we feel strongly that change can only happen through meaningful collaboration between environmental health scientists, physicians, advocates, and frontline communities. Environmental health research has shown us the myriad ways that exposure to common pesticides impact human health, but this knowledge is not useful if it doesn't reach the clinic, communities, and decision makers. During the last session, you heard from preeminent pediatricians and scientists about how pesticide exposures in early life impact child development. Later today, you'll hear more from Shanna Swan, Mount Sinai professor and author of the recently released book, Countdown, about how early life exposures to pesticides and other chemicals are impacting reproduction and fertility on a massive scale. There may be no population who suffers more direct health impacts from pesticide exposures than farm workers. We know from large studies like the Agricultural Health Study, a long-term study of more than 50,000 licensed pesticide applicators, that farmers are more likely to develop certain cancers than the general population. These occupational exposures to pesticides are also associated with immune dysfunction, asthma, and neurodegenerative diseases like Parkinson's. And it's not only the workers who are affected, but their families who live close to the farms and experience exposure through pesticide drift or take-home exposures when farmers track pesticides into the home on their shoes and clothing. Children living in agricultural communities also have higher rates of certain cancers, as well as cognitive and neurobehavioral problems like ADHD than the general population. The disproportionate exposures and health impacts of pesticides on farm workers is an example of environmental injustice. More than half of US farm workers are Hispanic. This number is as high as 92% in California, and an estimated 73% are immigrants. Many are undocumented and lack access to proper healthcare and worker protections. So today you'll hear directly from these frontline communities about how we can achieve agricultural justice for the communities and families that are literally putting food on our tables. Perhaps less appreciated are the direct, okay, I have to start that over. Maybe you can edit. Yeah. Perhaps less appreciated are the indirect impacts of pesticides on human health. We can no longer separate the destruction of ecosystems, loss of biodiversity, and acceleration of the climate crisis from the global rise in chronic disease incidence and severity. Pesticides contribute to climate change through the massive consumption of petroleum, energy, and water, and depletion of soil and ocean biodiversity is diminishing the capacity of the largest carbon sinks on the planet. So today you'll hear from experts in the fields of entomology, ecology, and environmental policy who are making these connections and using them to drive protective policies and practices. So I hope that today's program will convince you of the importance of bringing diverse voices together to promote practices and policies that improve the health of people and the planet. Thank you so much for joining us today.